My name is Chantel Young.
I'm Richmond Santos.
And today we'll be doing our presentation on pediatric advanced registered nurse practitioner. So why did we decide to do our presentation on PediatricARNP? We decided to do our presentation on pediatric nurse practitioners because it's a very rewarding career. It takes a very special, compassionate, and patient nurse to become a pediatric ARNP. It's also a career that you can have that has a lot of opportunities and an advancement. According to the American Association of Nurse Practitioners, only 8.3% of nurses decide to pick up a specialty in pediatrics. So today, we would just like to give you information about the education, the requirements, the health reform, and economics of becoming an advanced registered nurse practitioner.
Now, some of the requirements for an advanced registered nurse practitioner in the pediatric setting is requiring a minimum of at least 1 year as a registered nurse. But they do recommend 2 years as a registered nurse, and also you working in a pediatric primary care setting. As far as the education, first you're going to need your bachelor's degree, your BSN, from an accredited nursing program. You also have to pass the NCLEX. Now, from that point, you have two routes. You can get your master's degree, your MSN, or your doctorate of nursing, the DNP, to become a certified nurse practitioner. During this program, a nurse must take courses to relate to child care and psychology. On top of that, you need to complete 500 supervised clinical hours related to a pediatric nurse practitioner role and its population. Now, as far as the licensure, the American Nurses Credential Center and the Pediatric Nursing Certification Board requires applicants to have an RN license. Then you need to apply for the primary care nurse practitioner exam, and that's administered by the American Nurses Credential Center. The certification, the PNCB offers 2 certifications in pediatric care. They're both recognized in all 50 states. And recertifications and 15 hours of continuing education is required, but a wide variety option offered by meeting and annual education is required.
So, what are some job responsibilities when it comes that pediatric nurse practitioners do? So first, they have the privilege of caring for children who are in acute, chronic, and critical illness settings. They can conduct advanced physical assessments. They can order labs and diagnostic tests and also interpret these tests. And then they can do healthcare maintenance. This includes vaccinations, immunizations, and they can also do developmental screenings for infants, toddlers, and younger adults. Standards of care, scope of practice. So what are the scope of practice? Different states have different scopes of practice, but the only ones that I was able to look up were Alabama. So these are the scope of practice for Alabama. Nurse practitioners are able to arrange inpatient admissions, discharges, and transfers. They are also able to perform health and physicals by looking and doing assessment of the patient. They're also able to perform comprehensive physical examinations and assessments and plan and initiate therapeutic, medication, or medical devices. In case of emergency, they are also able to initiate treatment such as cardiac arrest. So the organizations that nurse practitioners can get involved in are NAP, and that's the National Association of Pediatric Nurse Practitioners. Also the AANP, and that's the American Association of Nurse Practitioners. The AFPNP, and that's the Association of Facilities of Pediatric Nurse Practitioners. And then a website that is good for pediatric nurse practitioners is the Pediatric Nurse Certification Board, and this allows the nurses to become familiar with their scope, their specialty. It has tests, classes, and new information.
I just want to talk about the nursing shortage related to pediatric nurse practitioner. Now, according to the Bureau of Labor Statistics, they're actually expected to increase up to 22%, from the span of 2008 to 2018, which is going to create a shortage. It'll take care of the nursing shortage with the increase of 22%. And also, according to the Bureau of Labor Statistics, there's approximately 581,000 more jobs coming up in the market. The nursing care outcome. As far as the nursing care outcome, number one is the quality of care. Now, the pediatric nurse practitioner offers the same care as a pediatrician. As far as the compliance of their guidelines, you're going to practice within the scope of practice relating to diagnosis with a combination of clinical data and evidence-based practice, which in return decreases patient mortality. There's a decrease in cost to patient and prevention. It's going to be more affordable to the patient than seeing a pediatrician.
Healthcare reform. The healthcare reform, the Affordable Care Act, was voted on by Congress in 2010 and was put into law by President Obama. And this reform was created so that people would have it could be accessible. Healthcare could be accessible and affordable. During this time, the organization realized that nurses made a huge impact and was a part of that change because they worked so close with the community. During this time, they noticed that nurses should practice to the full extent of their education. Nurses should achieve higher levels of education. Nurses should be full partners and effective workforce planning and policy makers. The recommendations came after these four things. The recommendations came into play, and they agreed that there should be removal of scope of practice laws, more residency programs, ensure nurses are engaged, and ensure that nurses have a lifelong learning. Economics. So healthcare economics. How are nurse practitioners compensated? So there are three ways. There's fee for diagnosis, and this is where the healthcare provider is basically paid after a diagnosis is made, and the healthcare worker is paid for that fixed amount for that diagnosis. And then it's fee for service. Fee for service is the healthcare worker, the patient decides which service they would like, and that service is what they would be charged. And then there's capitation. This is when the healthcare provider is paid a fixed amount for a service, whether that amount goes above or beyond care. And then voluntary insurance is something that the United States practices today, where insurance is paid for care. Evidence-based practice. So, evidence-based practice, topic that we looked into was neonatal intensive care units program reduces the length of stay in premature infants and improve mental health outcome in parents. So because the parents were able to participate in the care of their infants, it promoted change of care, the length of stay. The parents were more interactive and able to participate in care, and the facility around was able to initiate activities that parents can implement and experiment information. So legal issues that arise with nurse practitioners is employment contract issues. So nurse practitioners should be aware of contracts. They need to make sure that there's no clause in contracts, because sometimes contracts can limit opportunities. And then firing and termination is another issue that comes into place. Now more facilities are firing nurse practitioners based off their Facebook postings, filling out medical records before seeing patients, and things like that. Also, improper incidents to bill. Nurse practitioners need to become more familiar with Medicare laws. Previously, facilities were billed if Medicare information wasn't built properly, but now institutes are saying that nurse practitioners have the same resources as physicians and facilities, so now they're being billed. Quality of care. So what is quality of care to us? Quality of care is going above and beyond expectations. It is also involving the patient and family in care and making that patient center and focus of care. And that concludes our presentation.